questions about peptides because we're using a lot of peptides around here these days. And peptides are simply sequences of amino acids. So if you eat a protein-rich meal, you take in that protein. If you have good digestive fire, good digestive health, you break down that protein, and then your body recreates those amino acid sequences to do whatever it needs in the body. So whether it's going to, to extra hair growth and nail growth, or to repair tissues, or build muscle mass, or whatever the body needs, is it's going to create out of that protein sequence. And so peptides are just ways we can actually take in the body in more broken down form. So when we get collagen peptides, when we take collagen in, that's a form of different peptides that the body is pre-broken down. There's things like just amino acids, free-form amino acids, so that's taking it that next step, broken down from protein. And then there's very specific ways to use peptides, different tiny amino acid sequences in the way that we put them together to create very specific changes in the body. So one would be like insulin. Insulin is a very impactful peptide, very well-studied peptide. The GLPs, to help us to regulate appetite and how we bring in insulin, or how we utilize insulin and glucagon and create energy from the food that we eat. Those are all examples of peptides. And so there's a whole other category of peptides that we use for optimal wellness. Particularly here, we're using them mostly for, we have a lot of perimenopause and menopausal age patients that we just can't, the diet and the exercise and the nutrition and everything just only gets so far, the hormone replacement therapy. So this is just getting like icing on the cake so that we can take it that next level. How can we improve growth hormone without giving growth hormone? What kind of peptides can we give to help with recovery and skin health and preventing hair loss, and all these things that just become a little bit harder with age. And so that's how we're using them. There's a lot of practices that we use very specific peptides and inject them in joint spaces for joint repair and healing, trying to prevent knee replacements and things like that. Our goal with these peptides is really just to add them as part of an overall wellness protocol, so that we can just get that extra oomph, so we can do as well as we possibly can do as we are getting older, and another day on the planet, and trying to be our best selves. So yeah, I just thought I'd share.